Hi, good afternoon, and thank you all for joining us. I'm Steve Morrison from CSIS, and we're thrilled and honored to be able to pull people together today, the principal authors and organizers of the special issue of Lancet on MSM and HIV that was issued at the time of the International AIDS Conference in the third week of July. And following that amazing and very successful gathering, the two Chris's, Chris Beyer and Chris Collins, raised the question of shouldn't we, in a calmer moment, try to pull together many of the folks who contributed to this special volume to offer some more thoughtful and deliberate opinions around what's in this that has high value for policymakers as they contemplate putting into place a more detailed and operational plan of action for an AIDS-free generation. And I thought that was a great idea. I thought that it was very important because during that AIDS conference there was so much content coming forward that was so valuable, and it was indigestible in such concentrated forms. And so we've stretched out our series of activities in this form today. And I want to thank Chris and Chris for bringing this forward and then pulling the authors together and making it possible today. And I want to thank my colleague Sharon Stash for taking on the role of getting everyone organized and moderating and pulling this event forward. So welcome, and thank you all for being here. And thanks to the authors for taking the time to be with us today and in trying to really think through what the implications are of this terrific amount of serious work for policymakers looking forward. Thank you.
Hi, welcome everybody. Is this working? Yeah. In any case, as Steve said, we're here today to spur what we hope is a much, much longer and ongoing discussion between the scientists, those that you see on this panel and some that aren't present today, and policymakers about the implications of the data and the wonderful research that was included in that supplement of the Lancet. I think there really is a growing consensus that the issue of MSM and HIV can no longer be ignored. And it's a good time, and the Lancet supplement is really a good excuse to discuss how new knowledge should affect policy and programs moving forward. To run briefly through today's event, just to give you an idea of what's coming, we have our four panelists here at the table who've been asked to very succinctly sort of hit the main points or the top line findings and discuss some of the major policy implications of their work. After which we've got Chris Collins, who's here from AMFAR, to do a synthesis and sort of an overarching summary of how some of what the findings you've heard could and should affect policy and program moving forward. We're very happy to have Carolyn Ryan here from the Office of the Global AIDS Coordinator, and she has graciously agreed to us to be a designated respondent immediately following Chris's talk and give us a brief response to some of what she's heard on the panel. And then afterwards, we're going to have, I think, a fairly good piece of time for what we hope is a free-flowing and vibrant discussion and exchange between those of you in the audience and the panel at the front. So to sort of introduce our panelists, I think many of you probably know them quite well. Chris Beyer of Johns Hopkins University. Today, we'll discuss how the HIV epidemic among MSM differs from HIV epidemics in other populations. We've got Patrick Sullivan of Emory University. Patrick's going to present findings of his recent review of prevention interventions and the implications for the types of interventions we should implement moving forwards. Ken Meyer of Fenway Health and Harvard Medical School will discuss comprehensive health services for MSM and the importance of culturally competent care. And finally, Greg Millett of the CDC will discuss really a very interesting and very detailed paper that takes a good hard look at disparities occurring amongst MSM and Black MSM within the US, but also in Canada and some other settings. So With that, I'm going to turn it over to Chris.